estimated that around 8 to 13% of all women who die because of pregnancy related problem is a big contribution is by abortions. Okay, maternal deaths is the terminology that we use whenever there is a woman who's pregnant and happens to have a complication and happens to die. So 8 to 13%, like I said, is contributed because of abortions. It is believed that about 40% of all pregnancies all over are unplanned, and about 20 to 25% of these are unwanted. So, what happens when any woman at any point of time in her reproductive age group is presented with a dilemma of having an unwanted pregnancy? Now, termination of this pregnancy is called as abortion. Now, it is very, very important that when this is such a burning issue, and when we are saying 13% of women dying are because of unsafe abortions, it is very, very empirical that we make it very clear that any abortion a woman wants, it is definitely her right to do so, but where she does is very, very important. The first thing that I would recommend is choose your doctor. Do not be ashamed. The doctor is not going to be judgmental. Believe me, with the kind of protection that the MTP Act gives us and the amendment that has come recently, all qualified doctors are well protected and well within their rights to give you the treatment provided there is a right indication. To name a few, if you've had a contraceptive failure, you are 18, you are not married, you can still approach a gynecologist, get a termination, and definitely it will be done in very, very, very safe environments. Okay, so any woman, irrespective of whether married, unmarried, if there is a contraceptive failure, if it is a pregnancy because of rape, it is a pregnancy that is going to disturb the medical, mental or physical health of the woman, she can definitely opt for an abortion. Now, how do we abort a woman? Now, the government gives a sanction that up to 20 weeks, that is halfway through the pregnancy, till then, before the period of viability, that means the baby is unable to survive on its own. So that kind of a fetus we can terminate. So most of the pregnancies that we in our local clinical practice encounter are people who seek abortion treatment before 12 weeks, that is in the first trimester. That makes our job very easy, and it is less difficult even for the patient who's undergoing the treatment, because anytime after 12 weeks it is something like labor. That is what we call it as a mini labor, that is between 12 to 20 weeks, and the treatment modalities are also different. For example, a woman comes to me very, very early in pregnancy. Okay, she is a college going student, she is about 20. Unfortunately, contraception failed. She comes to me. She comes with a responsible partner that is good enough for me. Her consent is all I need, and I will be doing it in a very, very safe MTP Act approved by the government setup. So, four things that I will encounter is I will take her consent, I will put an opinion form, I will put her in the admission register, and I will also enter the name in the monthly register book. Okay, confidentiality for sure is a must, and nobody is going to be judgmental about it. Once we do a complete history taking, a clinical examination, and see that she's not allergic to any of the drugs and she is able to have a safe abortion, even if the products are going to get expelled in the house, even up to 7 weeks of pregnancy, provided she will come to the doctor and she's close by to the doctor, because 95% of the time whenever I give medications, I'm expecting her to abort. There is a small 1% chance that the pregnancy will stay back, 1% chance that the products may be half expelled, half stay back, or she may not respond at all. These are the very rare and less encountered scenarios that can happen, but most of the time, 95% of the time, she is going to safely abort. But please remember, abortion with a medical method or with a surgical method is not an alternative to a good contraception. Okay, you cannot use medical method of abortion as a method of contraception. Okay, contraception is a different issue. Aborting an unwanted pregnancy is a different issue. Though it has been made very, very simple in the last 5 years, it is very, very important to understand that this is a last resort. Always practice good contraception to avoid an unwanted pregnancy. The next thing is, suppose somebody crosses that vital period of 7 weeks or is not fit for medical treatment, that is the patient is asthmatic so I can't give those medications, or she's a cardiac case or a diabetic who's uncontrolled, then we go for what is known as surgical evacuation. These days we have very beautiful cannulas instruments. It is almost like a OPD procedure, and we just evacuate within matter of 10 to 15 minutes, let her rest for 4 hours, and then she is good to go. So these are the methods available in the initial 12 weeks. After 12 weeks, what we do is we will do something like a mini labor. That is definitely in a tertiary hospital. It cannot be done at a primary health care center or a setup which does not have adequate facilities for any emergencies that they may encounter. And definitely there has to be a blood bank, there has to be a ICU setup, and definitely you need consent of 2 experts to sign regarding termination of the pregnancy. The purpose of having 2 gynecologists to opine about termination of a second trimester abortion is that we are trying to make it safe and secure for the patient concerned. Okay, not trying to make things difficult. If, for example, a woman has taken termination, when do you approach the doctor? One, if there is uncontrolled bleeding, if there is fever, if she has foul swelling discharge, she has giddiness, uncontrolled pain, okay, any of these symptoms, please do approach the doctor. Though we say we give you tablets, say you have aborted, you have to come back for a follow-up where a scan is done and then confirm that the pregnancy is totally gone. Okay, there are incidents where patients think they've passed a lot of clots and think the pregnancy is gone, and when they come back for a follow-up maybe after a week or 10 days, the pregnancy is still going strong and it's just the clots that have been passed. So it is very, very important that you avail the help of a doctor for abortion, but make sure that you do it in a safe, approved place, and do not go to any local untrained, unskilled attendants, because they are the ones who do unsafe abortions and then land up in deaths of the women. Thank you.